All right, Mr. Constantine, thanks for joining me. Let's get right to it. Some huge information coming from the state today. Let's start with our county. What tiers are we currently in right now?
Well, so the state is notifying us as of today that Kern County is going to be moved from the red tier or tier 2 to the purple tier or tier 1.
Okay. And essentially, let's go over what businesses will be impacted by this.
Yeah, so most importantly, the state's notifying us that within 24 hours, our businesses have to revert to that purple tier. So most importantly, restaurants, the state would not allow to remain open for any indoor seating. They'd have to do curbside or takeout only. Gyms would not be allowed to be open indoors. And then retail is affected. Instead of 50% open, they have to be at 25%. And churches could no longer provide indoor services, according to the state. And movie theaters also couldn't be open.
Okay, so we know that the Fox Theater has a major show tonight, but does that mean now it's a 24-hour period? Is that half? Could it still technically happen? What's the case there?
So the state has indicated previously we have 3 days to give our businesses notice, and normally that occurs Tuesday, so everybody would have until Saturday. With the release of the information today and the change in the state's requirements, now going to 1 day, that would mean by tomorrow they're asking businesses to comply.
Okay, so the change is essentially when we find out what tier we're in, if we move back, we have 3 days to communicate to businesses so that they can make any accommodations they need to. Now, with the emergency break, that changes the communication to 24 hours. So essentially, within 24 hours of the announcement, those businesses would have to comply.
Yes, that's correct.
Okay. There were some other announcements in terms of the emergency break and communication with the state, with counties. Can you talk about that, the timelines there?
Yeah, so the state has been working on a number of approaches. We've been on a few conference calls with the California Department of Public Health, and now with the governor's announcement, they are making some changes to that whole tiered approach. For example, previously, a county would have to fail the metrics for 2 consecutive weeks in order to be bumped back to the more restrictive tier. That's now changing to just 1 week. You mentioned the time to comply from 3 days to 1 day is also a change. They have looked at a number of different options that they haven't yet implemented just because of the growing number of cases. And as the governor announced today, 41 counties moving into or already into the purple tier.
And he also mentioned that, for some counties, it's not just moving back 1 tier, it's moving back multiple tiers. Is that an effect of the emergency break that they pulled, or is that have to do specifically with that county's individual metrics?
So it's hard for me to speak to any other county but Kern. They don't share the data with us. It's only per county. My assumption is it's the metrics that pushed them back. As we're seeing growing cases, and you've seen our numbers here locally increased, it seems likely it's because of those increased case counts.
Right. And I know as the state has been learning more about, the virus, there have been certain changes to their approach on how, the ability counties have to, make various changes to what businesses can or can't do. And the state also said they're going to re-examine their tier system. Is there any indication that our metrics, the metrics for purple, red, orange tier will be changed to reflect that emergency break?
No, we've not heard of any discussion about changing the actual number within the metric. That seems to be stable. What they are asking, though, is because of those increased cases, the ability to either freeze or to kind of expedite the state's response to this growing concern. And that was mentioned when the blueprint was issued, that they have that emergency brake provision in there in case things unfortunately got significantly worse. And I think that's what the state's notifying us today as.
Okay. As of right now, what is our case rate? What is our positivity rate, and our health equity metric?
So as you saw today, we announced 301 new cases. So that's a significant increase than we've seen in the last few weeks. It's crept back up. The state has notified us today that our case rate is 16.1. So that's the average number of new cases per 100,000. That's averaged over 7 days with a 7-day lag. And our adjusted case rate is 17.9. Again, in order for us to qualify to be in that into that red tier, we have to get below 7. So we find ourselves now significantly higher in that case rate than we have previously. So that's a concern. Our testing positivity is at 8%, and our health equity metric is at 8.4%. So those are the percent positive tests within those areas. And again, those are running high also.
Certainly. Anything in our hospitalization rates, or are we seeing increases there too?
So we track our hospitalizations very closely. We work with all of our 10 acute care hospitals in the county. We have routine meetings with them. As you know, the county has made available up to 88 ICU nurses that the county will pay for at our cost. Hospitalization availability remains good. In fact, our hospitals have rarely been this healthy since we've been tracking. We have noticed in the last couple weeks that the available beds has decreased slightly, and some of our ICU beds have decreased slightly. It's not significant yet, but as we see increasing cases, our concern is that the more people that are affected and testing positive, there is the small percentage of individuals that do then get severely ill and have to be hospitalized, or even in the worst case, placed in the ICU. So we're going to watch that closely over the coming weeks. It seems reasonable to expect that those numbers will slightly increase. But to this point, the hospitals have done a fantastic job at managing their resources and to making sure those beds remain available to those that are most in need.
Do you have any specific numbers on hand at this time?
Sure. So let me give you the most current I have. Just 1 second here.
Yeah, no problem.
I have them on my fingertips for you.
Oh, no worries, you're good.
Okay, so we have, this is as of Friday, we have 866 available beds between all of our 10 acute care hospitals. We have 62 ICU beds available system-wide also. We have 61 hospitalized COVID-positive patients and 15 that are in the ICU.
Got it. Okay, I appreciate that. Now, obviously we're seeing increases in all over the state, according to Governor Newsom, according to the metrics we see on the public health dashboard. Why for us? I mean, just speaking for our Kern, in Kern County here, what do you think is contributing to this increase?
Yeah, those are important questions, and we don't have great answers yet. We've watched the increasing cases that have changed as it's kind of moved westward across the United States. We're certainly watching with interest what happens in Texas and the Midwest and some of those states and their hospital system. We've been sort of preparing for this potential increase. It's difficult to understand why. The virus is still relatively new to us. At first, we didn't know if it was seasonal. We didn't know if we would have just one peak or several. So we're learning more and more. But unfortunately, we find ourselves, as we did in July, facing a significant increase in cases, and we need to be prepared. These are important planning days for us. The hospitals are ready. Our alternative care site remains available at the fairgrounds. We have started to staff up at public health, so we have enough case investigators and contact tracers. But it's really difficult to know how many cases, and more importantly, as far as a hospital goes, how long this peak will last, because that's what matters. being able to provide that ongoing long-term care for those that really get sick.
In our case, some positivity rates that we look at each week are good indicators of how we're doing.
Yeah.
The numbers that you provided me, was that the 7-day average or the 14-day average?
No, it's the 7-day average.
Okay, got it. Now, you tuned into the governor's press conference. You heard the governor apologize for essentially violating his own rules, referring to COVID fatigue. Isn't prejudice. There's no prejudice in COVID fatigue. It affects everybody, as we've seen with the governor's actions. How can people combat COVID fatigue? What message do you have to the community for those people who are going, this is ridiculous, I am so over this, I just wish this thing would end?
Well, we share your concerns. We all feel the same way. We struggled at trying to think about wearing masks. That was all new for us. We've never done that. And then we got through the summer months when it was 110 outside and we were wearing masks when it was just really difficult. And it's tiring. It's tiring keeping up the effort. It's tiring not